Hello and welcome back to the East Lake Pet Talk podcast. I'm veterinarian Dr. Karen Fling, and I'm joined as usual this week with my co-host.
Hello everyone, I'm Dr. Will McCauley. I want to welcome everybody back to our last podcast before the Christmas holiday. Have some good info for you today, as well as a special guest.
Yes, we do. And joining us here today is our very own Sheila Flores. And she is part of our East Lake team. And we've asked Sheila to come today because she's doing some fun things at East Lake related to kids and birthdays, and even a few adults and birthdays. Yeah. Tell us what you've been up to, Sheila.
Yes, some years ago I decided to send out a letter to invite local schools, private schools, Girl Scouts, Boy Scouts to come out and have a tour, and they get to have a workshop, and they get to have a group discussion with a nurse and a doctor and some show and tell items, and it's just grown and grown.
Well, I think this is just great because as a mom of 4 kids myself, I know that when I talk to other mothers that there is a great deal of pressure for moms to come up with creative ideas for kids' birthdays. So I think this is really fantastic. So you work with the nurses and the doctors to have an educational experience and really let these kids see what happens behind the scenes at a veterinary facility or at a shelter operation. And what are some of the neat things that some of the kids have come away with after experiencing one of your tours and parties?
Yes, well, the importance is we want to show the children what's done behind the scenes to take care of our orphans for the East Lake Pet Orphanage, but also other concerns, which is spaying and neutering your pet to prevent the overpopulated pets, and also just the basic needs from medical care to general care.
Right, and I think it's so important that you're doing this because these kids are really going to be tomorrow's pet owners, and understanding what a responsibility it is to care for these pets and how important spay and neuter is, and just that whole message that there really is such an overpopulation issue within our community. And I think this is such a neat idea. I think it really transcends what we're doing locally. I think it's something that other facilities could offer as well.
It goes a long way to show how many people it takes to actually keep a vet clinic or a pet orphanage running as well. A lot of times pet owners will see the doctors and maybe one of the technicians or nurses and maybe the receptionist, but there's a whole army of people behind the scenes that these kids actually get to see, including the additional nurses, the pet care attendants, the nurses that don't actually work with the doctors but do the hospitalization, the testing, the pharmacy, and stuff like that. So it's really an eye-opener, I think, in a lot of ways for these kids to know, oh, there's this whole world back here going on. I think they value that.
Right. And speaking of armies, what is the biggest group that you've taken care of in one of these tours and party get-togethers?
The biggest one was we had about 100 students come out at one time, yes, and they brought the local news channel, WFAA, with them to record everything. And some of the team members who were helping me, they were so worried. They said, how are we going to pull this off? I said, we'll make it happen. And we just separated them into 3 groups, and while one group was participating in the group discussion with the nurse or doctor, the other 2 groups were going on the tour.
That's
wow.
great. Yeah. That's great. Well,
very cool.
That's just like Sheila, isn't it? She says, we'll pull it off. We'll make it happen. So,
right.
Well, we are awfully glad you're doing the work that you do to help these young people understand what's really involved with responsible pet ownership, and I think that message to adopt, rescue, and help a rescued pet is so well received by these young people. So if people do want more information about doing a birthday party like this or a tour, who should they reach out to as a part of the East Lake team? Should they call you directly?
Yes, please. Just call the main hospital number and ask for Sheila, and I can answer every question and schedule a birthday party and figure out what the parent wants to have. And then at the birthday party, they get to go on the roof, which we have artificial grass, and we bring out a lot of the orphans, and the children get to play and get to interact with the orphans.
That's great. And it is a garden roof deck, a flat roof versus so no children on a pitched roof.
Yeah. I schedule my birthday out there. That's great.
Yeah, that's right. And I'm glad you mentioned that because we've actually had a few adults that have decided to schedule a get-together, either for themselves to celebrate their own birthday or a pet's birthday. And
just a little get-together up for on the roof.
Absolutely.
If you do have questions and you need other ways to reach out, you can always contact contact us at podcast@welovepets.net. We have a new way to get in touch with us as well. It's a dedicated phone line that you can call in, leave questions about birthday parties or pet questions. The number is 972-808-6038. Of course, we always recommend subscribing to the YouTube channel as well, so you can get these every week. And just like to say thanks, Sheila, for coming in and talking to us about the birthdays and the Elpo Pet Orphanage. We look forward to having you on more shows.
Oh, great. Thank you.
Great. Thanks so much for coming. And we're going to take a little break and let Sheila get back to her work that she does each and every day. And we'll be back with more in just a moment. Well, last week when we all got together, we met Sandy, who is the pet of the week and probably mom of the year. And just to give you a little bit of an update, we can see her here with her puppies. And look at these puppies. Look what a difference a week makes. They're thriving. They're doing well. This week, their eyes became fully open. They're yipping. They're talking. They're howling. And just adorable and doing so well. And they're happiest when they're all snuggled up together. As you see here, and once they're snuggled together with mom, you could hear a pin drop, just as cozy and as content as can be. And these little puppies will be ready for an adoption through East Lake Pet Orphanage in about another 4 weeks. So before we know it, they'll be ready to go to their new forever homes. And if you'd like more information, don't hesitate to call us or feel free to log on at elpo.org. Welcome back to the East Lake Pet Talk podcast. Again, I'm veterinarian Dr. Karen Fling, joined with my co-host.
Hello, everyone. Dr. Will McCauley. It was fun having Sheila in here, wasn't it?
It was fun. Mm-hmm. It's always fun whenever we're around Sheila.
Mm-hmm. Have good stuff to talk about with the birthday parties and everything. I didn't know that was something that everybody could schedule.
Absolutely. Sheila will make it happen, and she's guaranteed to make it a good time for everyone.
Very neat. Very neat.
And speaking of good times, I had a pretty amazing weekend.
Oh, let's hear about it.
I know that I mentioned that my son had been asked to visit for an audition for Are You Smarter Than a Fifth Grader? So, of course, he was super honored to have been asked to come. We don't know whether he's going to actually be on the show, but we did take quite an adventuresome trip to Atlanta, and we traveled with his beloved cat, Mr. Butters, who happens to be an East Lake Pet Orphanage rescue kitty. Oh. And I have honestly never traveled with a cat on a plane before. Have you ever tried it?
I have not.
Well, it was a lot of fun. And so what we did was we kind of went through thinking about what supplies we needed. Of course, we made sure that our microchip information and our health certificate and our tags were all in order. We got a new collar for the trip and did quite a bit of preparation leading up to the trip. But the thing that was my biggest question mark was, how do you travel with a litter box and cat litter? And so we actually kind of put our heads together at the office there, and one of the nurses said, hey, just take a cardboard box, cut it down, and cover it with a plastic bag. And that's what we did. So lightweight, disposable, easy to travel with. But I will tell you, unless you really have a lot of spare time, it's probably not the best thing to travel with Ziploc baggies full of cat litter in your carry-on.
I can imagine so.
So presented a little bit of a challenge coming and going, and made the security checkpoints a little more complicated and more involved. And in fact, one security individual said that she had, in 7 years of checking bags and doing the security checkpoint clearance, had never seen cat litter travel through.
I believe that. Yeah.
So
certainly not the weirdest thing. I'm sure somebody's trying to sneak
probably
through
not,
security,
but they were
everything.
having to go through the bags of cat litter and doing all kinds of chemical testing and making sure there was nothing inappropriate going through onto the airline. But better safe than sorry.
Absolutely.
But one thing I wasn't quite prepared for, I assumed that with all the discussion about how the kitty would have to stay enclosed in the carrier for the flight, I assumed they were going to have the cat stay in there the entire time. But when we went through security, they actually had us have Mr. Butters come out of his little little carrier.
In the terminal?
In the terminal there. So right there as we went through security, and they let me carry him and hold him as we passed through, which was good. But I thought, goodness gracious, if you don't have a well-behaved cat and a cat that is inclined to stay close to you, I just pictured the cat bolting and running off through the airport, and it could be a disaster.
Yeah.
And so while we had a harness and a leash with us, retrospectively, I probably would have had those things on inside of the carrier for that part when he came out, but we couldn't have had a better time, and just did great in the hotel, and I would definitely travel with him again.
Good. Well, it definitely takes a special pet and a special pet owner to be able to get through security like that. But yeah, I can imagine if the cat got loose in the terminal, you'd be on the news.
I'm
pretty sure you'd be on the news.
Didn't want to
for
make
that.
the news that way, that's for sure.
Yeah.
So speaking of news, what's on your mind, and what have you discovered in the news this week, Dr. McCauley?
So having all kinds of fun animal news stories. There has been a story that was kind of kicked around this past week, stating that Pope Francis had made not a declaration, but had made a statement that led people to believe that the papacy now believes or confirms that animals will be in heaven. The quote was, it says, "One day we will see our animals in the eternity of Christ." This was originally attributed to Pope Francis, but actually it was said by Pope Paul VI several decades ago. Pope Paul died in 1978, and so apparently it's been quite a while that the Vatican has been open to the idea that pets will be seen in heaven.
I've thought for a long time that they have to be there.
Yeah.
How could it be heaven without them?
I'm not going to be happy without a couple dogs running around.
And a few cats.
And a few cats, absolutely.
Maybe some chickens.
A few chickens, yeah, not too many. In other news, kind of on a different subject, New York City's mayor, Bill de Blasio, has actually said he's going to follow through on his campaign promise to do away with horse-drawn carriages in the Big Apple. Apparently, there have been concerns over cruelty to the horses, as well as the issue with manure and just having the horses down around that many people.
Right.
It's been kicked around for quite a while, and the plan so far is actually to follow through with outlawing those carriages.
How about that?
Yeah.
Well, if anybody visits the Big Apple, those horse-drawn carriages have been just part of that landscape for as long as I can remember, and kind of a picturesque part of that Central Park area and Tavern on the Green and that whole section there. So I imagine there'll be a little sentimental sadness for a lot of people. But, I have to say I kind of agree with that decision. As much as I've loved seeing them last few times I've visited the big city, I just kind of felt like those poor horses looked a bit tired. So.
Yeah, and just from a logistics standpoint, having to house them there within the city limits and the amount of manure that is produced, while not nearly as great as back in, I'm sure, the the dawn of the 20th century can still ruin somebody's day if you happen to step in a little pile of that. But yeah, so that will be done away with. So if you're in New York anytime soon, take a trip on one of those buggies, and maybe the last time you'll be able to do so.
Little piece of history.
Little piece. So that was for news. I do have, we always try to highlight a certain disease on the show, per show, to kind of get you up to date with the different diseases and infectious, diseases that can be found.
And I know what you're thinking of, and that's got to be leptospirosis
That's
this
right.
week.
That's right.
Yes, we've actually had 2 confirmed cases of leptospirosis at East Lake just this week. And with both of these cases, the pets did present with significant illness. One particular patient, which was one that I worked with personally, I think the family actually caught it so early on, though, that they were just beginning to see signs of this particular dog drinking more, urinating more, some changes as far as actually increased appetite, which sometimes can happen with liver problems. They actually get almost like a pica where the pets want to eat unusual things outside of the norm. But tell us a little more about lepto. What do we usually see with that? What are the classic symptoms we think of?
Yeah. So as we said, leptospirosis is a communicable disease, a zoonotic disease, so it can go between animals and man. A lot of times in our pets that we will see, kind of the top sign that we look for is kidney dysfunction. That's a big one, as well as liver issues, sometimes GI disease, but really the big one that we usually look for is signs of kidney problems. It has to be on our list of rule-outs if we do see increasing kidney values.
In fact, with leptospirosis, it has risen to the #1 cause of acute kidney failure in dogs, which is
I did not know that. Yeah.
Yeah, number one now.
Yeah. So it is a bacterium. It is a spiral-shaped bacteria called a spirochete. It is transmitted actually in the urine of a lot of different kinds of animals: rodents, raccoons, possums, cattle, swine, dogs, horses, buffaloes. If you have a pet buffalo around, sheep and goats.
And I had even heard birds can vector this. Have you heard that before too?
I have.
Yes.
Yep, they had some information on that that's not quite as well defined in birds, like chickens and geese and turkeys, but it can be. They do believe it can be transmitted via birds.
And what do you hear about cats relative to leptospirosis?
I haven't seen a cat with leptospirosis yet.
I've not seen cats with it, and up until recently, I always thought that cats were immune to infection with it, but something I read recently made me feel that they could be perhaps a less likely victim of leptospirosis,
right. But
that they could actually get it and potentially vector it along.
Well, there's so many diseases out there. You want to follow proper, health, proper health and safety standards all the time. You don't know
and avoid urine contact if there's anything unusual. And as you mentioned that this is a lot of times thought about as a kidney disease, I'm amazed at how many people I come across that when I ask them about kidney health, they say, oh gosh, there's no problem with my dog's kidneys. He's drinking a ton and urinating a ton, and somehow they think that increased drinking and urination is a sign of kidney health, when actually it can be quite the opposite.
Could be a sign of kidney disease, exactly. Once
right.
a certain portion of the kidney becomes non-functional, a lot of times these dogs are not able to concentrate their urine down to the right amount, and the urine that they are excreting is very dilute, and so it actually dries them out and dehydrates them, and they get thirsty again.
Right, so just water in, water out.
Yep, called polyuria polydipsia, PUPD. Talk about it a lot in vet med.
Exactly.
Yep, the signs in humans include fever, chills, headache, muscle aches, abdominal pain, jaundice, if enough of the liver is affected, skin rash, red eyes. You can actually get it as well from swimming, rafting, or kayaking in water that has been contaminated by animals who have lepto. So definitely keep aware of stuff like that. If you ever go swimming in a river or a lake and there are cattle nearby, or you've seen raccoons and possums around, think twice about taking a dip.
Indeed. And I do think as we read about leptospirosis in the literature, there is always that mention of water being part of the infection process or the infective stage of this organism. But I do think that pet owners should be aware that water doesn't have to be a big pond, a big lake, a stream. Certainly it can transmit in those reservoirs, but even the dewy grass and the moisture on our plant life, and just the dog walking across the damp grass and then coming in and licking paws, that's enough for that organism to be contracted in its infective stage.
Yeah, absolutely. We think of a wet environment, as you say, being a lake or a pond or a river, but these are bacteria. These are microscopic, organisms that need
a little drop is like a lake for
it's
a
exactly
bacterium.
what swimming pools worth for them. Yeah. So the big thing is to be aware of the disease and the clinical signs of it, and as always, take your dog to see the vet at least annually, if not more often, because we can vaccinate for this, and that is one of our core vaccines.
The good news that it can be largely prevented through vaccination. And once a pet does contract it, if they're not vaccinated, the earlier you detect the problem, the greater likelihood for a successful treatment. And you want to again look for any changes in drinking, urination, any changes in appetite or attitude. Any of those signs can be a signal that you need to see your pet's doctor. And we're going to go ahead and take a break right now and actually switch over to visit with Dr. Pennington, who's one of the other doctors on our team that has another patient that's been going through a treatment for leptospirosis. So we'll be back in just a moment with more with Dr. Pennington.
All right, welcome everyone. We're here at East Lake Veterinary Hospital, where we're going to talk to Dr. Kayla Pennington about leptospirosis. She actually had a case last week, and it was really interesting. Can you tell us about it?
Yeah, so we had this little dachshund, really cute little girl, come in with a history of 2 weeks duration of increased thirst, increased urination in the house, having accidents everywhere. And then about a week prior to coming to me, she just started feeling ill. She didn't want to eat, she didn't want to drink, she didn't want to play. She just seemed kind of down in the dumps, so to speak, and we ran some routine lab work, a chemistry panel and a CBC panel, and we actually saw some elevations in her kidney values, which is pretty unusual for a young girl, and she actually had a high white cell count indicating infection or inflammation. And based on the history and the evidence of kidney damage, we went with a running diagnosis of leptospirosis, and we had to intensively hospitalize her for, I believe it was about 48 hours on, high amount of IV fluids, IV antibiotics to kill the bacteria, supportive care to help with the vomiting that she also had. And she was lucky enough to make almost a full recovery. We're still working on getting her kidney values back down to normal, but she went out of here wagging her tail, doing so much better.
Great.
Yeah, so she turned out really well.
Yeah. Well, 48 hours may seem like a long hospital stay, but some of these can go a lot longer.
They can. Yeah. I've seen some go as long as 7 days or a week and a half.
Wow.
Top. Yeah.
So it takes a while to get back. So how is this disease transmitted? We talked some, back in the studio about it, but how does it, what's its life cycle and all that?
So the bacteria is shed in the urine of wildlife, so rats, possums, raccoons, other wildlife, which we have an abundance of in the Lake Highlands area for sure. And what happens is the dogs, or humans actually, interact with the urine, not on purpose of course, but the dogs will sniff the urine and they actually can transmit them through the mucous membrane, so their gum tissue, or if a human has a cut on their arm, they can pick it up that way. And it goes to the kidneys and it actually causes an acute kidney crisis or acute renal failure. It can also travel to the liver and cause acute liver failure as well. And in my little girl's case, she was lucky enough just to have problems with her kidneys, but it can affect both organs, and those can get very serious very fast.
Yeah, serious disease affects all those organ systems. You talked about testing for it. What did this testing involve?
So we did our basic in-house lab work here, which is a CBC and a chemistry, kind of like what we have here, where we can look at liver values and kidney values in our red blood cells and white blood cells. But to actually test for their leptospirosis bacteria, we had to send her blood off to a special lab, and they had to grow the bacteria and to come up with those results. So it actually took a good 4 or 5 days before that we got those results back, and she was lucky enough that she got better before those results came back. But it can definitely be a benefit to know if they're actually positive or not, because it can kind of change our treatment plans, especially if they don't get better.
Yeah, he said treatment involves IV fluids and antibiotics. Do they go home with medications as well?
They do. They go home with oral antibiotics as well, and other kidney support, such as fluids under the skin every day that they do at home, and other renal care support, new diet, a kidney diet until we can get those kidneys back to 100% normal function. And unfortunately, there are some cases where they just don't regain function, and they will kind of have an underlying chronic kidney disease for the rest of their lives that we have to manage.
So no fun to treat. Is it preventable?
It is. It's very preventable, especially with the vaccines that we have. The vaccines cover the 4 most common species or subspecies of this bacteria. And my little girl's case, she actually came up positive for one of the ones that the vaccine covers. So her case could have been avoided completely if we had the vaccine on board, and unfortunately I don't think we did. But vaccination, while it's not 100% preventable with the vaccine, you can significantly decrease their risk, which is of utmost importance in this area since we do have so much wildlife in the area.
Yeah, definitely. And we do offer that vaccine here at East Lake?
Yep, it's actually one of our core vaccines. It's not even an option. So we put it in with our distemper and our parvo vaccines, our rabies vaccines, and our kennel cough vaccines as well.
Okay. Well, like we always say, an ounce prevention is worth a pound of cure. I think Dr. Fling had mentioned several times that it costs between 2 to 9 times as much to treat a disease as it is to prevent it. I'm sure that was the same in this case.
Yes, her bill was quite high, and I believe our vaccines are, $20, something like that, and her bill, I believe, was almost $2,000.
Wow.
Yeah.
Okay. So definitely
just for 48 hours of care and fluids.
Man, a lot easier to prevent. All right. We appreciate you talking to us today. We'll check in from time to time with some cool cases. I want to remind everyone, if you do have any questions, to send to us either to Dr. Fling, myself, or Dr. Pennington. Email us at podcast@welovepets.net. Let's go back to the studio.
Okay, very good. Thank you so much for that information, Dr. Pennington. And so we're back here at the East Lake Pet Talk podcast, and we're just about ready to wrap things up. Dr. McCauley, what advice do you have for our pet owners?
Well, as always, if you do have any questions to get onto the show, you want us to answer, you can email us at podcast@welovepets.net, or that new phone line that we talked about earlier in the show. There is a dedicated number you can call, 972-808-6038. Leave us a voicemail with any questions you may have, or if you want to see a topic on the show you want us to cover, let us know. And as always, subscribe to our YouTube channel so that you can get these podcasts every week.
Absolutely. And that's what we're here for. And we want to be sure we're answering your questions and making our show the most relevant we can possibly have it be. And we wish everybody a Merry Christmas and Happy Holidays. And we'll see you the same time next week.
Take care.